Hello, my name is Dr. Mary Ott. I'm a pediatrician and adolescent medicine specialist at Indiana University School of Medicine and the Riley Hospital for Children. We reviewed the literature on the adolescent brain and then conducted a series of interviews with 40 14 to 21-year-old young parents. Our goal was to better understand how young parents make medical decisions for their children and then how they communicate about those decisions with their child's healthcare team. Here's what we found.
This is a teen brain.
You may have thought of teens as being impulsive,
Risk-taking hooligans.
Without much of a frontal lobe.
And surprise, the reality is a little more complicated.
It turns out in most healthcare situations,
teens make similar decisions to adults.
There's a key difference between me and an adult, though.
I just don't have that much experience making these kinds of decisions.
And to someone without that much experience,
being asked to make big medical decisions for my child can be intimidating,
scary,
terrifying.
So how can you help me make the best medical decisions?
You need to understand what drives me as a young parent.
My child's care is a team effort.
But I want to feel like I have a say.
I'm a parent and I want to be treated like a parent.
So talk to me first about medical information.
And talk to me directly.
Even if there is an adult in the room.
Like a grandparent or an older sibling or Aunt Marge.
Love you, Aunt Marge!
Talk to me, the parent.
Ask for my permission to share the information with family members.
It'll make me feel like I have some control.
I have an especially hard time making decisions in highly emotional situations.
Or if I'm distracted.
Sometimes it's best to diffuse a tense situation first,
before having me make a decision.
Give me some extra time or support.
And look, I'm new to this whole parenting thing.
I may not have much confidence in my decision-making skills.
So if I ask a good question or spend extra time to care for my child,
let me know.
I like feeling like a capable parent.
Asking questions can be tough for a new parent.
I don't want to sound dumb or uninformed.
I want to prove that I'm a good parent.
So if you ask me things like, do you have any questions?
Or, do you understand the diagnosis?
I might just give you the answer I think you want to hear.
Even if I actually have no idea what we're talking about.
Ask me to explain my understanding of the diagnosis and treatment.
That way you'll have an idea of what gaps in my knowledge need to be filled.
When you're explaining conditions or treatments,
it really helps me to have visual aids and diagrams.
Break down the language for me.
Maybe remind me that it's helpful to take notes.
If I'm going to be part of this healthcare team, I need to know that I can trust you.
I'm more likely to open up if I know that you're concerned about my kid too.
Little things can help earn my trust.
Like helping me with parking,
supplying diapers,
or gift cards,
checking in to see how I'm doing.
Even just being prompt and arriving at appointments.
Be yourself, be honest.
I'd rather talk to a nerdy doctor than a sympathetic best friend.
And please be patient.
It's probably been a stressful time for me, so I'm bound to have a bad day once in a while.
I respect adults who can roll with the punches, even when I'm not at my best.
Hopefully this video gave you a better sense of what motivates me,
what worries me,
and what I need as a young parent.
All that's left for me to say is thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.